here we are, and thank you for joining us. We're sitting in our office, and we'd like to help you learn more about cataract surgery. And so we're really excited. I've been here. My name is Barbara Aliaga, and I'm the executive director for the Harmon Eye Clinic, but I've been here for 27 years. And about 2 years ago, I had cataract surgery, and I had a very special lens put into my eye. And so I'll be telling you about that a little bit. And next to me is Pam Miller, and she's the refractive consultant here at the Harmon Eye Clinic. She's been here for about 10 years. She's also had different surgeries, and one of the most interesting ones was a lens that's put on top of your iris, and she was minus 12, and I don't know if you know what that is, but she could not see beyond probably 4 inches.
Yeah, about that.
Without her glasses. So she went through, years ago, she went through this surgery and has really appreciated it. And lately she's had something called monovision. She can tell you about that, so that she can read, and that'll give a little bit about her age, but not much. So anyway, she'll be talking to you, and next to Pam is Brandy Summers, and she is the ASC director, and that's your surgery center, and she makes sure all the nurses and doctors and anesthesiologists all perform together as a great team, and all for you. One of the most important resources for you is the cataract surgery workbook, and you can get a free copy ahead of time. We'll have one for you when you come for, maybe I can't get there. Oh yes, I can. So if you click on the Harmon Eye Clinic, you actually will see our blog, and you might want to talk to this fellow just a moment. He just had what was called a symphony lens cataract surgery, and here he's going to tell you how he feels.
Okay, so so I was saying 2 days ago, my left eye was unusable. Basically, I couldn't read anything or make out much of any characters in the real world. I could make out images is about all. And my right eye I thought was near perfect in distant vision and reading. And I needed reading glasses or computer glasses for doing those kinds of things on my right eye. Today it's just kind of like the opposite. It's the left eye the contrast on my left eye is amazing. It's better than my right eye. When I compare left and right, I noticed a distinct yellowing on my right eye now that I wasn't aware existed, and it appears smoky on the outside. So yellow and smoky in my right eye, whereas before I never knew that existed, and it's only because the left eye has become so much more clear. So that's my initial impressions, I guess.
Awesome, thank you.
We have a section here for cataract surgery, and you can download the booklet into a PDF and then print it out, or just read it from the internet.
My name is Brandy, and I'm the director of the surgery center, and Pam and I are here for you to help you to know what to expect for the cataract surgery consultation and what you can expect on the day of the surgery. And one of the most unique things I think about where our staff and our clinic and surgery center is that everybody is here to just help you get your best vision, make you feel comfortable, and we're all genuinely happy for you and excited for you to help along this way.
So during this seminar, we're going to talk about how cataracts affect your vision and understand some of the tests that we do and exams, and discuss the processes that lead to surgery and learn what to expect after surgery. And we have some questions that other patients have asked that we're going to try to address also. Also, before I leave that, if you have a question that we haven't addressed, if you would just go email us or call us and talk to Pam directly and ask that question. We'll be able to incorporate this your question into this seminar. So you see our doctors, and it's Dr.
But Dr. Ballin is one of our surgeons, and Dr. Weatharn and Dr. Bajenova. So start with Dr. Ballin. He went to Medical College of Virginia. His medical degree is from there. He did his internship there at the University of North Carolina, and as you can see, his residency at Duke University. And he is, of course, board certified.
I bet you didn't know something.
What is
Did
that?
you know that he received his BA in East Asian Studies?
Oh,
You did know that. Well, and Dr. Ballin speaks fluent Mandarin. He loves to play tennis and practices yoga, and he relaxes through Chinese watercolor painting.
Mm-hmm. So next we have Dr. Weatharn, and he received his medical degree from Tulane University. He did an internship at the Navy Medical Center San Diego, and his residency was from the University of Florida, and he did a fellowship in cornea and refractive surgery through Jules Stein at UCLA. And he is also board certified.
Now, Dr. Weatharn has an interesting background. He served as a lieutenant in the Medical Corps, U.S. Navy, and served here in Bremerton as a senior medical officer, medical department head, and radiation health officer. Dr. Weatharn oversaw all issues pertaining to health and safety of a crew in excess of 500 sailors.
Mm-hmm.
He was deployed to the Persian Gulf for operations, Desert Strike, and Southern Watch. Dr. Weatharn was deployed to Central America for 5 months to counter drug operations. He was senior medical officer afloat the 1998 Deployment Task Force with responsibility for health of over 1,000 sailors on several ships. Dr. Weatharn also served as primary care physician in Everett Naval Base Medical Clinic, and he received the Navy and Marine Corps Commendation Medal for meritorious service while serving as medical officer in USS California from August 1996 to July 1999. As medical officer in USS California, spearheaded the creation of a shipboard health promotion program that was twice awarded the Navy's Green H Award for Excellence. Yes, and he runs a tight ship.
Yes, he does. We also have Dr. Bajenova. She graduated from University of Washington Medical School. Her internship was there at the University of Washington as well, and her residency at Kellogg Eye Center, and she is board certified also.
I hope I can say this right. Dr. Bajenova holds impressive credentials. Dr. Bajenova came to the United States from Russia in 1999. She attended a medical university in Russia and actually was ready to become a doctor. When she came to the United States, she found out that she would have to earn her Bachelor of Arts all over again. And she did, and she went to medical school, as we just talked about. Plus, she's just a most wonderful person. We all agree.
In a moment, we're going to go over things like what is a cataract, what causes a cataract, and how does a cataract impact my lifestyle. We have a quick video to watch that goes over some of these things, and we'll go over that here in just a moment.
Cataracts are a part of the aging process, but they do not have to interfere with your lifestyle. A cataract is a cloudiness of the crystalline lens inside your eye. As your lens gets cloudier, your vision will gradually become more blurred. The human eye may best be compared to a camera. When you take a picture, the lens in front of the camera allows light through, and focuses that light on the film. When the light hits the film, a picture is taken. The eye works in much the same way. The lens of your eye is clear and allows light to pass through. Light is focused by your cornea and lens onto a thin layer of tissue called the retina. Your retina works like the film in a camera. When the focused light hits the retina, a picture is taken and sent to your brain. While a dirty camera lens blurs a picture, any significant cataract in your lens will blur what you see. If a cataract grows large enough to impair your vision and affect your daily activities, cataract removal is recommended. Cataract removal is a common procedure and is safely performed millions of times each year. During the procedure, the cataract surgeon removes the clouded lens that has affected your vision and replaces it with a clear artificial intraocular lens. As a result, most patients can achieve a noticeable improvement in their vision. Cataract surgery used to require a fairly large incision in the eye and the use of sutures to close that incision. Today, technological advances allow surgeons to work through an incision much smaller than in the past, usually requiring no sutures at all. Small incision cataract surgery is made possible by using high-frequency sound waves known as ultrasound, or phacoemulsification. The sound waves break a cataract up into tiny fragments that can then be removed through the small incision. The other advance that makes small incision cataract surgery possible is the foldable intraocular lens implant. These implants are made of soft materials, which can be folded like a taco or rolled up with a special instrument, allowing them to fit through very small incisions. Once inside the eye, these lenses unfold and return to their original shape. Small incision cataract surgery is less invasive, allows patients to resume normal activities soon after surgery, and provides the fastest recovery of vision. Some people mistakenly believe that having cataract surgery will enable them to see perfectly without glasses. Having the eye's natural cataract clouded lens removed and replaced with a clear artificial lens implant should certainly improve your vision. However, the conventional artificial lens provides a single fixed focus. It cannot give far distance focus one moment and near focus the next, like the eye's natural lens does in a young person. Thus, after cataract surgery, eyeglasses are still needed in order to shift the focus of your eye from far away to close up. While we're young, the focusing muscles inside our eye can change and control the shape of our natural lens. This change in lens shape allows us to shift our focus from far away to close up, and this natural focusing ability is called accommodation. Unfortunately, the eye's natural lens hardens as we age, and as it loses flexibility, we lose our accommodation. The term used to describe this natural and unavoidable loss of far to near focusing ability is presbyopia. By our 40s, our diminishing ability to focus up close must be replaced with reading glasses, bifocals or trifocals. Conventional artificial lens implants do not correct presbyopia because they cannot replace the need for reading glasses either.
Just in passing, there's a lot of information that you're hearing right now, but it's better to hear it now than to come to your consultation and be given so much information in such a short amount of time. So another really good place to go is called allaboutvision.com, and I could go there, but it'll take us a while to get back. But it's a place that we send patients often because it'll talk about the different kinds of cataract, but it'll talk about allergies, and it's a very good resource for you. So in passing, that's what I'm telling you. So how does a cataract affect our vision? Or maybe we ought to talk about maybe could you talk about a cataract, even though we'll see another video
Yeah.
too?
So the majority of the time, the cataracts develop slowly, and so slowly, and usually in both eyes, that you aren't even aware of the implications they're having on your vision. Colors may become dull. Your contrast sensitivity may be worse than it used to be. You may notice that you're avoiding things you like to do, whether it's fine print activities, reading books with fine print. If you're avoiding going to things at night because you just don't feel comfortable driving at night, and that gets worse over time, those are telltale signs of a cataract, and they sneak up on you. It's not something that happens overnight usually. There are types of cataracts that come on rather quickly, but the majority of our patients have cataracts that come on rather slowly. So let's see here. We developed this cataract self-evaluation test, and it's a helpful tool, and I've given this to patients in the past. And if they are diagnosed with the beginnings of cataracts and they're anxious about when is it time for me to have cataract surgery, how do I know I'm ready? And we'll give them this checklist and just have them. I tell them, just put it on your refrigerator and look at it every couple of months. Just kind of give yourself this self-evaluation. Are you still able to do the things you like to do? Whether it's reading a newspaper, sitting down to read a book. Do you feel like you have to be closer to road signs to see them? Are you avoiding things like driving in the rain, driving when it's really sunny out, or driving at night and rain? Once your cataracts and your vision is affecting your daily life, that's one of the key components that insurance companies look for and the doctors look for to know that you're ready for surgery.
So there's a few more. One of the things people seem to do, and I know I did, was when you're walking downstairs, you end up thinking, well, this must be my age, and so you're holding onto the railing going down, but really what you're doing is you can't really see that well to know where the next stair exactly is, because after surgery I noticed that I almost
bounded down the stairs again.
I like France.
Pranced down the stairs. Because it gives you a new way of looking. So you don't really realize that it's the walking down. You think maybe you're just stiff, but you're not really stiff. You're just very cautious. You don't want to break a leg. And then driving is something that I did a lot of from work. I'd come a little bit later in the winter and leave a little bit earlier in the winter, and then I'd stay later in the summer. And it finally dawned on me, this is because I can see in the daylight and I cannot see very well at night. And then there's starbursting and rings around light, glare around headlights. When you notice it's almost like a little fog around the headlight coming at you, that goes away pretty much after surgery. So those are the things. You almost have a dirty windshield.
Yeah, it's like looking through a dirty windshield. Yeah, exactly.
And the other thing, maybe when you're reading a book, you find you just need more light. So you might just ask yourself now, how do you feel right now? Your vision is affecting your life on a scale of 1 to 10. So you might, when it gets into the 7, 8, 9, 10, it's pretty much the time for you to say, yes, I'm ready to move ahead. The doctor can always see the cataract, but if you want your insurance to pay for what he sees, they require that you have some kind of lifestyle change. In other words, it's affecting what you're trying to do. You no longer can sew.
This is a good one for me.
Yeah.
Does insurance pay for cataract surgery? Yes, absolutely they do. As we just mentioned, if it is affecting your activities, getting you things you need your vision to get through the day, if it is affecting that, then yes, definitely it does. Insurance does pay for that standard conventional cataract lens. Oftentimes you will need reading glasses after surgery, especially if you need them before. Does insurance pay for cataract surgery with premium lifestyle lens implants? Again, insurance pays for that standard portion of the surgery. When you do choose that lifestyle lens, Medicare permits you to pay out of pocket for that premium lens package. What are these lifestyle lens implants? Well, since 2005, the Harmon Eye Clinic has been placing these premium lifestyle lens implants. They're designed to help you see far, close, and everywhere in between with functional vision. What is functional vision? Well, you are able to function without glasses, but may at times wish to use glasses for sharpest of sharp vision, like teeny tiny print, very dark areas.
Like night
Something
driving,
of
things
other-
like that.
Mhm.
Okay.
Now I would say I'm pretty much able to read anything on the computer, but there are times, say, when you do your income tax, and you want to make sure that you're reading all the tiny print. Then it's not that you can't read it, but you can read it faster with glasses, and so you may put them on. But like medicine bottles, I can read all of that. Just about everything. If I'm willing to take the time, I can read. But what I had there now is even something greater,
Oh, yeah.
because the latest FDA approved premium lens, the latest approved is called the Symphony lens implant. So take it away,
Yeah.
Brandy.
So the Symphony lens implant is a pretty exciting advancement when it comes to lens implants. This lens, where in the past with lifestyle lenses, most lifestyle lenses have offered two focal points of vision. So you can see in the distance and you can see for intermediate, or you can see in the distance and you can see for reading. But those two focal points are basically being split from the one light that comes into your eye. So that light in a natural eye without a cataract wants to focus onto the macula. And if you remember from the earlier video, your natural lens will change its shape and flex and focus to change where that beam focuses in the eye to help you with things like reading and computer. Once you have the cataract or the lens implant placed at the time of cataract surgery, you can have the monofocal lens, which is one focal point onto the retina, and then you wear glasses or change your glasses to change where that focal point sits on the retina. And then the lifestyle lenses up to this point have been lenses that offer two focal points, so distance and intermediate, distance and near, but it's somewhat of a compromise of your vision, if you will, because it's taking that single beam of light and splitting it to focus in two separate areas on the retina. Well, with the Symphony lens, it's what we call an extended depth of focus lens. So it takes that single beam of light and extends the focal point so that it's always in focus, no matter where you're looking. So it's distance, intermediate, near, using your computer, sitting down to read a book. Your eye, it's always in focus on the retina. It doesn't have to split that beam of light. It's still using the one beam of light. And it has the ability to accommodate for not only nearsightedness, farsightedness, and astigmatism, but it is also able to accommodate for other types of imperfections in your vision. So it can accommodate for the way your eye perceives light, if you will. It improves contrast sensitivity, and it's a pretty exciting advancement.
The gentleman we saw at the beginning,
He had the Symphony lens, yes. Yeah, that first video you saw of that patient, he was very, very impressed, and he and I spent a lot of time on the phone before surgery answering questions, trying to decide, do we want Symphony, do we want the Technis multifocal, which is one of the lenses that splits the light. He was considering a crystal lens, which is a lens that also splits the light but flexes and moves inside of the eye. And after receiving all the information, he decided to go with a Symphony toric lens.
and we do have other lenses, but they probably will be used for very specific people, because the Symphony lens is so extremely popular at this point. The True Line is what I had, and I'm very, very happy with it. I mean, I after 2 years, I still reach up and try to take glasses off, but they're not there. So it's pretty amazing. But there's a crystal lens. And you can see all of these on our website.
Oh, yes. Yeah. And it's not, one of the things that I think is most beneficial about our doctors and the programs that we have here at the Harmon Eye Clinic is that everything is tailor-made for you, for you, specifically for you. We never come in, the doctors never go into the room thinking, this is exactly the lens I want for the patient, I'm going to sell them on it. It's a matter of looking at your numbers, at the calculations that we've taken during your exam, looking at the health of your eye. Does your eye have the potential to see this well? And then also looking at your daily living, things you like to do every day. Do you mind wearing reading glasses? If not, then we're not gonna.
We're done.
We still tell we're done. We tell you all of your options. We let you decide, but they're not gonna push you into something that doesn't fit your needs and your lifestyle. So that's one of the things I truly appreciate about working here is it's not a one size fits all. It's very much boutique, if you will. So
Yeah.
everything's tailor made for you.
And you know what? We've been here for 32 years, and you realize we live in Arlington. We realize that patients have to be happy afterwards.
Mhm.
They don't go away after you do surgery, so you want to make sure that you listened really well beforehand, and our doctors are really good at doing that.
They are.
They're popular. I just put this in here.
No, I think that's good.
Yeah.
But patients do feel uplifted when you can remove your need for glasses, even though you might choose to wear glasses once in a while, or say at night or early in the morning. The idea that you don't really have to in order to drive or in order to do what you want to do, there's something that just makes you feel young again. Stairs we've already talked about, and life just seems easier. So the next video we're going to watch is an informed consent video, which means we want to make sure that you look at the risks and benefits. And when you watch this, and if you take the quiz, which is on a PDF, and you could either use, well, just you could print it out and bring it with you to an exam. But if you do that, you don't have to watch that video again.
When you come in,
When you come in. And it does take time, so it prolongs your exam, and you might want to do it now. But we'd like you to watch it with us, and it might spark some questions. So here.
At this point, we'd like to direct you to our webpage. So if you would pause this video, we're going to go on your browser and go to www.harmoneyeclinic.com. So put that in your address line on top. And once you're there, tap on the cataract link. And then tap on the quiz link, and it's just under the informed consent video link. Now, when you see the quiz, go ahead and print that out if you can, or put it to the side and open a new window with your browser, go to the Harmon Eye Clinic, and tap on informed consent, the informed consent video, and view it. You'll want to take the quiz at the end of the video to bring with you to the appointment. Once you have completed the cataract informed consent, come back to this online seminar and click play, and we'll continue. Thank you. Call us if you have any trouble. Don't forget to press pause on this online seminar video. Thank you, and open up a new window in your browser. Thanks.
One thing I really enjoy about this informed consent video, although some of the material may seem repetitive or dry, or that may be really interesting, but I think it allows you to take the time to receive all the information, hear it, and then maybe it gives you questions you didn't think to ask. It may answer questions you've already thought of, and then it may help you to make up your mind whether or not you want to proceed with surgery. But I've always enjoyed that about the informed consent video, that it makes me think about things I wouldn't otherwise.
Which is why I think it's important to watch it from home before you come in for your appointment, so you can put those questions together and have them when you come in.
This is a lifestyle questionnaire, and again, this is something that's in the brochure.
Mm-hmm.
So if you download it, you'll be able to fill this out and think about things about how you use your vision, and that's what you were talking about. So look for that, and if you don't bring this in, then we'll have one ready for you when you're here. But it's nice to think about it before people are asking you a lot of questions. You go, I don't know.
Yeah.
So now we have some questions, which well, we're not ready for this, so let's cut for a second. Wait a minute. 1, 2. Now, one of the best ways to prepare for your consultation is to use the patient portal. You can put all your insurance information, is that correct?
Yes, you can put your insurance information, your primary doctor that you see, your eye doctor that you see, your medication list, your medical history, really everything. It's got a lot of options of different things that you can put in. It asks a lot of questions, so you don't have to put anything in there that you don't feel comfortable answering.
Mm-hmm.
Yeah, and the medication part, it's really, I think that's one of the most exciting things we've got, advances we've had through this patient portal, is to add in your medications before you come in, because I know in the heat of an exam and trying to figure out, I don't remember if it's twice a day I take that, or if it's 50 milligrams or 100 milligrams, and if you take the time at home to do that and fill out the patient portal, add in your medications, you'll have control over what goes in your chart, and to know that it's the right medications, the right dose, and the right strength. I think it'll be an exciting time when all of the medical chart notes are able to be read from different doctors, but we're not there yet. So it does help the exam a lot, doing that information.